So good morning, everyone, and welcome to St. Paul's Chestnut Hill. We are very excited to have a panel today, that part two of our conversations on COVID-19, the prevention of the spread of COVID, with a focus today on transmission through aerosol and particularly through singing, and to know a little bit more about what our practices are in not only in this church, but in other churches in the diocese, and what the science is teaching us. But I just wanted to welcome the panel, and I can tell you a little bit about the panel. First of all, we welcome Dr. Priya Krishna, who is a laryngology specialist from Murrieta, California. And Dr. Krishna completed a residency at the Southern Illinois University School of Medicine. She is affiliated with the Loma University Medical Center, and she was very involved in the co-authoring of a very good study, one of the latest studies published in the Journal of Voice on safer singing practices. So we'll be hearing about that today. And thank you for getting up a little earlier this morning. You're on the West Coast. We really appreciate that. We welcome back Dr. Neil Fishman, who is Associate Professor in the Department of Medicine and Chief Medical Officer for the University of Pennsylvania Health System. And he completed his medical residency training at Temple University in infectious diseases. And we're glad to have Neil back with us again. And our third panelist is Canon Kirk Berlenbach, and some of you know Kirk has been in this diocese many years and has been very helpful to St. Paul's. I remember a conversation about the use of our buildings, and Canon Kirk, his title is the Canon for Innovation and Community Engagement at the Episcopal Diocese of Pennsylvania. And Kirk, along with the bishop and other diocesan staff, have been advising us and other churches in the diocese on how to proceed with COVID prevention. So we're very excited to have the three of them with us today. So what we're going to do is we will begin with some questions that have come from a number of sources to kind of get the panel started. I would ask you to mute your mics so that we try and keep the quality of sound high. And if you have specific questions that you would like, please put them in the chat box, and Dan will field and Carol will field those to us when we get to that part in the program. So let me begin by asking Canon Kirk about, first of all, thank you all for the support that your staff, your colleagues have given to our diocese. It's been a very difficult, challenging year, and the support of the bishop for the clergy and the care of the parishes and helping with vaccinations. We really all appreciate that. So can you give us a sense, your own sense of what are the kind of systems and science that you and your colleagues are drawing upon, and what are some of the challenges that particularly face the churches, and how locally we are meeting those challenges?
Thank you, Albert. Good morning, everyone. Thank you for this opportunity to be with you. It is a great joy and an honor. In terms of our approach, which is what I hear you asking, Albert, you know, we try to look at as many sources as possible. We're looking at scientific studies from a range of reliable options, looking at primary sources like the CDC, as well as Pennsylvania Department of Public Health, studies from Johns Hopkins. In terms of singing, we've looked at some studies coming out of the University of Colorado, as well as others as primary sources. And then we try to balance that by looking at what are the needs of the churches, knowing that our church buildings aren't always up to date technologically in terms of their ventilation capacities. You know, the leaded glass windows that open out at a slight tilt doesn't produce a lot of great ventilation. They don't have modern HVAC systems that can have HEPA filters or MERV 13 filters, those types of things that can help to mitigate the risk. So we're trying to balance everything that we're learning with the realities of our churches and our church buildings, and all within the context of, as Christians, we have a holy obligation to care for one another. That is part of the central to our calling as Christians. And so we always have to be thinking of that and making sure that we're accounting for everybody. We're monitoring the numbers sometimes on a daily basis, and coordinating with public health officials. The bishop coordinates with other bishops, as well as both within the Commonwealth and nationally. And then we have a diocesan health committee with clergy, many of whom were medical professionals prior to becoming clergy, who help to advise us. And we just try to balance all of these things, keeping in mind, how can we allow as much flexibility for our churches, while at the same time establishing minimum standards for safety and security.
Thank you for that very careful. I'm really impressed by the advice that you're all giving us almost kind of weekly, because I know this is changing. And so I shift to Dr. Neil, and since you were last here, we have seen a rise of infections. Could you give us a sense of what's happening on the ground? What are you seeing in the hospitals? What are some of your concerns as we look at opening up? More people are coming, more people are vaccinated now, more people want to come to worship. What are you seeing on the ground that will shape us moving forward?
Good morning, everybody. Thanks for having me back. So the status of the pandemic in the Philadelphia area is mirroring what you're reading about nationally. After the winter surge, we did have a significant decrease, and then about 6 to 8 weeks ago, the number of infections increased, and we've been at a plateau for about 6 to 8 weeks. Although we did see another increase following Passover and Easter, likely due to gatherings. And we've maintained at this level. Now, it's nowhere near the level of infections that we saw last year at this time. Last year at this time, we were just peaking in the first wave, I guess, or maybe just a little over a year ago this time. Of the new infections that we're seeing, the vast majority are in unvaccinated people who are younger, because they didn't qualify for the initial wave of vaccines. I also suspect that the increase is due to a decrease in mitigation strategies. Some of that is political, in that there's been an easing in restrictions at restaurants, bars, and gyms. And additionally, people are tired. And I don't think anyone expected to be dealing with this 13 or 14 months. And people are letting their guard down. Additionally, in the Philadelphia area, we have seen an emergence of some variants, although not as extreme as in other areas of the country. At Penn, we've analyzed, I think as of last week, 520 isolates. About a third of them were the UK variant, which is covered by the Pfizer and Moderna vaccines, and about 10% was the New York variant, And then we've seen a spattering here and there. I think where we are right now is somewhat in a race between the emergence of variants and vaccination. The SARS-CoV-2, the virus that causes COVID-19, is an RNA virus. Every time it replicates, it mutates, and the mutations that are more likely to survive will predominate. So as long as the virus can mutate, can replicate, there will be mutants and the emergence of variants. The only way to stop replication is to vaccinate. So we're in a situation now where there's a race between vaccinating a majority of the population and in order to quell the emergence of variants. We're still seeing hesitancy. There's a very good article on the front page of the Inquirer this morning that addresses some of the hesitancy or at least scientific irrationality with respect to the vaccines that we're seeing. But I am fairly confident that if we can continue to vaccinate, continue to mask, and continue to maintain social distancing, that we can decrease the spread of infections in our area and nationally. I'll end on a hopeful note and tell you I don't like to look at 1 or 2 days of data and call it a trend. But on Friday and Saturday, we did start to see in the area a decrease in positive tests and a decrease in hospitalizations. It's just 2 days, but we can keep our fingers crossed.
Yeah, and we're very grateful to you and your colleagues and the healthcare system in Philadelphia and Pennsylvania for helping us to look at that. So I want to shift to the science, because we wanted to hone in on the science of aerosol transmission and singing. And Dr. Priya, Krishna, you have this wonderful article that we're sharing in our Screen Safer Singing. And I understand you're also a musician. You sing yourself, and I think that's a really great connection. Can I just remind those of you who have joined a little later, we're putting questions in the chat box, and Dan will field those in a couple of minutes, but please feel free to enter your questions. So Dr. Priya, can you tell us a little bit about the science and some of the challenges? I mean, there's a lot of competing data out there, and it would be really good to hear from somebody who's in the middle of all of that to interpret that for us as we want to sing more in church.
Thank you very much for the opportunity to speak with all of you. Certainly this topic is dear to my heart because I've spent many years in community choirs, and I know what an emotional support it provides and psychological support. So not having it is very detrimental, and I understand that. What we know from the fairly small number of well-done studies looking at particle dispersion and aerosolization, what they've told us with regards to singing is that speaking at a certain level, gives you a certain amount of aerosol transmission. Singing and playing woodwind instruments increases this significantly. And the other issue is how long these aerosols are buoyant in the air and present in the air, because they can stay on surfaces. We do understand that they're in the air for at least an hour or two, if not longer. So that is the concern. The two good studies that I would cite are from Australia, and then the Performing Arts Aerosol study, which looked at both singers and woodwind players. And what they found is the loudness of singing affects the amount of aerosols that are dispersed. Certain consonants can also affect this. Not to say that you have to restrict yourself to a style of singing, but these are all things that we have to consider. The Performing Arts Aerosol study did look at mitigation of aerosol transmission with the use of masks, and there was a significant decrease in the number of trials that were analyzed. So we know that masks do provide a significant degree of protection. We know that social distancing is also very critical. And that's been borne out in multiple studies that have come out since the paper that I was involved in last summer, which it's surprising. It's already a little outdated how quickly science travels. So I think the point that I want to drive home is this gets back to the principles that we learned about last year, that masking, social distancing, and vaccination are the three most important elements of mitigating the risk of transmission and potential, infectiousness of this virus.
Thank you so much. And so as we are thinking in this parish about, we're moving from 4 singers to 8 singers next week. So this is really good timing. So maybe open this to the whole panel. The question is, what would constitute responsible engagement? What are the kinds of ingredients? And I know, Kirk, we're lucky we have a large sanctuary, but you're dealing with various different scales in church buildings and so on. But are there some principles that maybe apply across the board? And maybe how will the diocese kind of create a kind of, is there a one size fits all, or how are we going to deal with this?
Certainly, we want to offer advice that can be as universally applied as possible. In addition to what Dr. Krishna was saying, we do try to emphasize ventilation as well as a key factor. And I did reference that, knowing that different church buildings have different capacity for that. So, for example, so many folks are interested in getting back to congregational singing. We determined that it was safe to allow that outdoors for now. Hopefully by the fall, when folks are moving back inside due to weather, we may be at a different stage in our understanding, and the virus may be at a different stage, so we can revisit, is it safe to sing congregationally indoors? So we're trying to always, as I said, strike that balance between what we believe the science shows is reasonably safe, right? Nothing's completely without risk, but where the risk is mitigated enough that it's reasonable to do with what our people are longing to do. So we try to look at that, but I do want to point out as well, though, recognizing that sometimes church have a unique need, that our bishop always will entertain a proposal from a church. No guarantee of it being approved, but if you have a specific need that falls outside of our protocols or guidelines, by all means, please make the case to the bishop, involving myself and my colleague Canon Walmsley when you do, and he will get back to you. Sometimes he says yes, sometimes he says, I'd like to say yes, but I can't for the following reasons. But we do recognize that one size fits all does not always work for all churches.
Neil, would you like to add to that at all in terms of Kirk mentioned ventilation as a key factor. Any thoughts on that?
Ventilation is critical. It's certainly something that we rely on in the healthcare setting. In hospitals, there are architectural requirements for a certain number of air exchanges per hour in order to maintain safe ventilation, in order to maintain a safe environment. Obviously, churches are not built to those specifications, particularly older churches. However, you can achieve a level of safety by decreasing or by limiting the capacity. So I know that at St. Paul's, your sanctuary holds, I believe, 700 people. Philadelphia restricts you to 20%, I believe, but you're are only having 50, I believe, per service on site, which I think makes it makes it much safer. The mitigating strategies that will help with safety, as Priya said, are first of all masking, secondly social distancing, and then thirdly vaccination. And I hope we will see a day when 80 to 85% of the population is vaccinated. If you reach that within your congregation, I think it would be relatively safe to continue or to have indoor services. Although I think it is critical to always defer to the diocese. But for the time being, it's critical to maintain masking, social distancing, and to continue to try to increase the vaccination rates in the area.
Priya, I was going to ask you about masks, because we have our surgical masks that many of us use. Some of the choir members have a different kind of mask. Is there advice on the kind of mask that we should be wearing? I mean, we've talked about ventilation and spacing, but is there something more specific around masks?
So the ASTM International is putting out some recently compiled standards on what to look for in masks in terms of filtration efficiency. The level 3 is the highest level achievable. I would say, looking at the standards, at least a level 2 would be appropriate in any mask that you were to buy commercially. The surgical loop masks are still very appropriate. The most important things about masks are not only the material, but the fit of the mask, making sure that it's very snug around the nose and the chin and that there are no gaps, because otherwise the mask is really not very useful. You're still allowing for aerosol dispersion. So, as opposed to, commenting on exactly the type of material, the fit of the mask is almost just as important. And you can have some guidance by looking at the ASTM International standards when you're trying to find a mask that works.
Thank you. So I'm going to open up now to some of the questions. I see some questions are coming in. Dan, would you like to field some of the questions? Just read them for people who are maybe listening in.
Yes, we have one question specifically related to singing in our space. If we were to use the gallery, which is basically a balcony in the back for some singers, could we have 8 up front and a few in the back gallery? And part of that, I guess, is there's a protocol question there. And then there's also, not only does it fit within the protocols, but is it safe to have people above singing and projecting onto a congregation?
I'll take the first stab at that. The first question I would ask is, are the singers vaccinated? And if all of the singers were vaccinated, I would be comfortable increasing beyond 8 if they could, again, if everyone was masked and if they could maintain adequate social distancing in that area.
I would echo Dr. Fishman. I'm sorry, were you finished?
No, I said, what do you think, Priya?
Yeah, no, I would echo with what Dr. Fishman had mentioned. I think that vaccination is a very important strategy to allow us to return to singing. The social distancing, if that's going to be feasible in the gallery, I think is fine. I think the fact that they're above is not going to make a huge difference if you've added in the ventilation improvement of the ventilation in your space. If you're able to open windows and such and have, MERV 13 filters in your space, if that's possible, machines that are not too loud. I think all of that can help. And I think that's a reasonable strategy.
I do just want to add one thing, and it's a bit of a wrinkle in terms of whether folks are vaccinated or not. Absolutely, deferring to the medical guidance, it absolutely helps. But we do run into potentially some legal issues around, are we allowed to ask? And I think it's also important that, unfortunately, we can't just take somebody's word that they're vaccinated if we're going to be basing a risk behavior on that. So that also then gets into ethical, legal, and political issues. So my point in saying this is only to say that sometimes it gets more complicated, and we're doing our best to balance all of these things. It's all emerging, right? I mean, the science is continuing to emerge and evolve, as is the legal and employment issues around it as well.
Dan, go
I
ahead.
completely understand that that concern and that wrinkle. I would ask the congregation and choristers to use the honor system and just be aware of your responsibility to your fellow man, because I think certainly in the healthcare field that has become so evident in the last year and a half. And I think that should be equally evident wherever you go in the community, and where, more so, in your congregation. So I think that's important to keep in mind, regardless of the political issues involved.
I'm sorry, Neil, go ahead.
Oh, it just, there are issues with what we can and what we cannot ask. We are still in a public health emergency, and some attorneys would argue that you can ask the question, but the bottom line is that I agree with what Priya said, and that we need ultimately to rely on the goodwill of individuals and their desire to protect their fellow man.
Right. The next question, is the absolute number of singers important, assuming all of them can be adequately masked and distanced? Our space at St. Paul's is very large, and I can imagine that we are better able to handle more singers.
I think that if you can maintain the recommended 6 feet of distance, that we have from the science so far, if you can maintain that between all of your singers and everyone's masked appropriately, I think that that's safe. I would add, however, it's an extra layer of mitigation, having as many of those singers vaccinated. So I think that's, critical to look into if you're going to want to fill as many singers into that space as you can.
Right, and then from the diocese related to that, there are limits on the number of singers allowed. Like, is there a universal cap right now, Canon Kirk?
Yeah, yes, 8 is the number right now, which, as I understand it, St. Paul's has just elected to move towards. And certainly this would be an example where, if it was to be determined that St. Paul's felt that it could safely accommodate more than 8 and wish to do so, that would be an example. If the diocesan protocols have not changed, that would be an example of the kind of thing you could write a case to the bishop and ask for permission to expand. I would point out, though, as Dr. Fishman noted, our numbers are still not great. 2 days, we hope they're moving in the right direction, but I checked all 5 counties of the diocese still have a positivity rate above 8%. We really are looking to see that get down closer to 5. My point in saying this is simply that maybe pushing to maybe this is not the optimal moment to push to expand for anybody. That is not directed specifically at St. Paul's, but across the diocese. We want to be cautious a little longer.
Thank you both. We have another question, and I guess this is related because some people have mentioned if the singers are vaccinated, it lowers the risk of mitigation. Can people who have been vaccinated still be spreaders, or does that risk go down a lot?
So this is controversial. The bottom line, I'll start with that, is that the risk is significantly decreased. Early on, there were the early literature suggested that people could still harbor the virus and spread it to others. The more recent data indicates that the risk is significantly reduced, that if people do have the virus, the titers, the amount of virus that people have is significantly lower than in the unvaccinated population, and the rate of spread is significantly lower. No vaccine is 100%, but at least with the Pfizer vaccine and the Moderna vaccine, the absolute rate of protection does approach 95%, which is really unheard of in the vaccine in vaccine science. So the bottom line is that there is a small risk that people who have been vaccinated can spread infection. It appears to be extremely low, and wearing masks during a potentially aerosol generating activity like singing would reduce that risk even further and make it negligible in vaccinated individuals.
I don't have a lot to add to what Neil had just said. I would agree with everything that he said. So.
Our next question is, as was mentioned, the Performing Arts Aerosol Study issued mitigation recommendations that include masking, social distancing, and HVAC recommendations. They also recommend limits on the number of people, which I think we just discussed, but also amount of time participating in aerosols generating activities indoors, and breaks in time between uses for fresh air replacement depending on the ventilation. How should these additional factors influence our thinking?
I'll speak to that. Since that is really the only really in-depth study with some very well validated methods that we have to point to, I think the recommendations put forth by that study are important. I think they're very reasonable in terms of the use of HVAC and the limitation on the time of rehearsals or singing involved. So, I think some of the ways to balance, balance out the risk of transmission versus, the need to continue to rehearse and be able to sing is having the smaller groups and breaking into shifts, using a time period of 60 minutes or less for rehearsing. Ideally, they mentioned 30 minutes in an indoor environment. I think that's somewhat difficult. I think adding vaccination to that piece, again, mitigates the risk further. And so you could probably stretch that to an hour. But I think it's important to keep in mind that the time that people are in quarters close to each other, even if it is within that, or if they're maintaining the social distancing, I think that time factor also has to be adhered to, and you shouldn't go over what's been recommended so far, because that's all we have to point to at this time.
Yeah, the only thing I would add, or maybe two things, one would be looking at the occupancy of the space. And if it's a very large space with a extremely low occupancy, which is how I view the St. Paul's right now, that does add an additional layer of safety. And then if you would probably have some time between services, which I know you do, or between rehearsals, that would add another layer of safety.
I know that Andy has to leave in a minute for getting ready for services. Andy, I'm sure you've got lots of questions, but I see you've asked a question, and feel free to use this time before you go. When will singers be able to ditch the masks?
I'll take the first stab at that. I don't know. Is the true answer. I think once we achieve herd immunity, and I'd like to see 80 to 85% of the population vaccinated. Unfortunately, I commented earlier in the someone asked this question. I commented, unfortunately, the vaccine has been politicized, and there are a lot of myths that we are fighting against. We have some hope that it may be possible in settings like church, where a majority of people are vaccinated, that will be able to ditch the masks. I will say, parenthetically, I don't know if any of you must have realized this, but the influenza rates this year in the area were negligible compared to prior seasons. I can tell you in the Penn system during peak influenza season, we would see somewhere in the order of 110 to 150 influenza isolates a week. We've seen 6 all season, the entire season. And now vaccination rates were higher this year, but many of us think that it's masking and social distancing and good hand hygiene that have contributed to it. So there is some talk in the public policy community, the health policy community, as to whether we should always mask during influenza season. There is some, masking may become a part of our culture, at least during peak respiratory virus season. But with respect to when we can ditch the masks altogether, the optimist in me would say sometime next fall, at least in settings where we know a majority of people are vaccinated. And we do know, today the CDC is recommending that families can gather without masks if everyone is vaccinated.
I don't have a lot to add to what Neil has said, as far as when we can ditch the masks. I think that, we probably can't ditch them anytime soon. I think we still have some milestones to reach in terms of, herd immunity and the like. So I think that I think we should get used to them for a little while.
From the diocesan perspective, it will be when there is clear scientific consensus that it's safe to do so. And otherwise, I defer to the scientists.
Yeah, Andy, anything else you wanted to ask the panel before you head off to play the organ?
No, but thank you all today.
Thanks, Andy. So let's have the next question, Dan.
With regard to congregational singing, can you speak to the psychological versus physical health effects of not being able to sing?
Well, I think that's a little bit of a loaded question. I mean, I think anyone that finds singing a part of their life knows how much a part of their life that is. And there's nothing that really replaces it. However, you know, I get back to appealing to our ideal self, or, you know, our conscience, as far as, you know, continuing to practice strategies that help mitigate risk transmission, you know, including the masking and the social distancing, and, you know, making sure that you're vaccinated. How can we substitute for that? You know, there are opportunities to use technology. You know, the technology is not ideal, but it's becoming better, you know, to do virtual rehearsals, and, you know, being able to splice tracks. You know, if you're, you know, having a performance, you can pre-record performances so that your congregation can participate. I mean, none of these are ideal, but I think until, you know, we get to the point, you know, where we were mentioning before, we've reached those milestones, I think that, you know, we'll have to sing, you know, in our own homes for a little while. Or, you know, if we're in a church, you know, a large church where social distancing is feasible, I think we have to, you know, adhere to what the diocese is recommending, and where, you know, we're getting, you know, these other recommendations from scientifically. So
I agree. I agree with Priya. I think, you know, it is important to recognize that the critical aspect that our spiritual being and beliefs play, how they interact with our health and safety. And it's important today that we maintain the appropriate balance. And I have to say that I have been very impressed by your diocese and the way they have approached this, and the way they are balancing the science along with the congregation's spiritual needs.
the other point that I'd like to make is that we are finding now the effects of COVID infection and some of the long-term sequelae on the larynx and the lungs. And, you know, once you've had the infection, these effects may be long lasting, and they include trauma to the vocal folds from the coughing, you know, hemorrhage. These are things that can create permanent scarring and may affect your ability to sing. You know, when your lungs are damaged, you lose your breath support. That will also really significantly impact, you know, your ability to sing. So, you know, I think we have to ask ourselves, is you know, this, is the singing with our congregation, you know, if we haven't all been vaccinated, if we don't have the ability to socially distance, is it worth it? Is it worth it to me to take that risk?
I want to thank both of you for that, and for those kind words and that support. Janice, I feel the pain that I'm hearing you express. I priest kid, so I grew up in the church. I've been singing in the church forever. I feel that loss, truly. It is a delicate balance where we are trying to, you know, prioritize the obligations that we have, knowing that it is balancing meeting different needs, and the primary obligation right now would be to draw on our elder sisters and brothers in faith in Judaism, you know, to preserve life, to choose life, knowing that there is a loss for us spiritually. Seeing another question here from Meg, we are allowing singing, congregational singing outdoors now. We believe that the ventilation created, as long as there is spacing and masks, is an acceptable level of risk. So we're introducing it at as much as we can within balancing that primary obligation for safety. And I do want to say that recognizing that this has been there has been sacrifice, there has been loss, there has been pain by people who long to be together in church, who long to sing together in church, who long to hug one another and share fellowship and food and all of the things that are so central to our, at the core of our life together as believers, as the community of believers in the church. We do not have a single case that we know of church-related transmission. Not one. So I say that only to say that although this has come at a cost, we hope that the cost has been worth it because we can show that nobody has caught COVID by attending any church activity so far that we know of.
So we had a question earlier, and Dr. Fishman, you addressed it in the chat, but I think it might be worth our bringing in. How do we get to herd immunity? What, as you've noted, the vaccine has been politicized, and I think we'd all welcome thoughts on how we might encourage our friends and families and neighbors and congregations to go get vaccinated.
So I think there are two streams of resistance to the vaccine. There's political resistance, and I think the answer is the same for both, but in there with the far right, we need to continue to stress the science of the vaccine, the efficacy of the vaccine. More than 140 million people in the United States have been vaccinated so far, and adverse events have been negligible, and the protection is real. The other avenue that's somewhat more difficult is among the Black and brown community, and we've been trying to address that in many different ways within our West Philadelphia community where I work, and that is grounded in years of systemic racism. When you talk to people, the first thing they mention is Tuskegee, and how can you prove to me that this isn't another Tuskegee, and that I'm going to be getting the same vaccine as the white people? And then there are a lot of myths that are circulating, which it amazes me that intelligent people sometimes ask questions about implanting tracking chips, implanting 5G technology, a scheme to make the Black population infertile, and I could go on and on, and so that is, and the way I personally have dealt with that is by showing the data about the risk of COVID in the Black and brown population, which is, in some instances, the risk of death is 200 times higher than in the white population. And we have slowly been able to make inroads by having colleagues talk to them, by making the vaccine more easily accessible in the community and even in the workplace. It is an ongoing struggle. I think a lot of the stories on the news shows this morning are highlighting that the rates are going down. We got to 50% vaccination rate relatively quickly. I think it's going to be a bit of a slog to get to 85. So it's going to be a marathon, not a sprint.
I'm watching chat for other questions. Are there things on folks' minds?
I saw is the congregation still not allowed to sing mask? I think I would defer to the diocese on this, but I think that we have talked about many of the issues and the variables that are involved in whether or not the congregation can sing behind the mask. I think the fact that they have the mask, first of all, is very important, but this also speaks to the ventilation in that area and what the social distancing ability is of the space. So, if the diocese has taken that into consideration and, has figured in the level of vaccination, I think that they can make that decision.
Yeah, I think for it is certainly, I think, safe to have congregational singing outside, and I'm hopeful that maybe by the fall, as we achieve higher vaccination rates, that perhaps the science will support moving indoors, but when it starts to get colder again.
A really interesting question has just appeared in the chat. Could anyone speak about shifting the balance from official restrictions to individual decision about personal risk, as for various political and other reasons, mitigation efforts have been lifted? How might we shift that balance?
Boy, I'd almost defer to Kirk to answer that, to answer that question.
I'll be glad to try. I'll be glad to try. And it's a great question, Arabella. I think it goes back to within the church. I can't speak for what the ethos should be for governmental decision making, but for us as the church, we really do have that collective identity and therefore collective responsibility. I can foresee a time where we can say that pretty much everybody who's going to get vaccinated has been vaccinated, whenever that time will be. I don't know when that will be, but at a certain point, we're, not many more people are going to be getting it if they haven't gotten it already. At that point, it could become, that may shift our thinking. For right now, while there's still a large number of people that need to get vaccinated and perhaps need the education or persuasion or time that they need to get vaccinated, I think we have to be thinking, continuing to think collectively in terms of our ethical and sacred responsibilities for one another.
I'm going to make two comments, and I'll try to make an initial comment about the last question that just popped up, and then defer to Priya quickly since we're getting to the end of time. I'm going to start with a political comment for everyone. There was a time when the recommendations coming out of the CDC that I didn't have a lot of confidence in the recommendations coming out of the CDC. They were limited by the political environment at the time. I know Rochelle Walensky well, the new head of the CDC, and I am confident now that the recommendations coming out of the CDC are based on science and don't have and are not being impacted by a political agenda. So I think we can all take some confidence and solace in that. With respect to Hugh's question about the distancing of transmission beyond 6 feet, that data is generally created in a laboratory environment, and it is when there are very high viral loads and without a mask. So I think it is mitigated by these strategies that we've discussed. Certainly, if people are wearing a mask, don't have to worry about transmission beyond 6 feet. And secondly, if people are vaccinated, the titers are negligible if they're present at all. So I think if people are vaccinated and wearing masks, that we don't need to worry about transmission or spread beyond 6 feet. Priya?
I would agree with everything Neil has said. I think we know that there can, that, you know, from earlier studies that airborne transmission was highly likely. However, we have added all of these mitigating strategies to this, and that would significantly decrease the risk of airborne transmission. So I think when we're putting prevention upon prevention upon prevention, I think that we've, you know, significantly reduced the risk. And, you know, ventilation improvements include singing outside. So whenever that's allowable in the part of the country that you're in, or, you know, if the diocese has that ability, I think is a very good choice.
We are just about out of time, so I'll ask us to thank our really wonderful and informative and gracious panelists for being with us this morning. Thank you so much for sharing your knowledge and your wisdom and your expertise with us.
Thank you so much.
Of course.
Thank you.
And be well. Join us at on YouTube at 11. So.
Okay.
Great stuff. Thank you.